January 21st, 2011. I'm on the top of the world. I've just finished one of the toughest Ironman competitions in the world. Standing on the podium, I felt like nothing in the world can stop me. A few months later, the doctor told me it's ALS. It's 3 to 5 years. Nothing we can do about it. Definitely not what I had planned. Over 150 years after it was first described, it is still an orphan disease with no cure or treatment, and even the cause of it is still unknown. In addition to being rare, it progresses very quickly and differently in different patients. There is always a gap between the research done in the academia and the clinical trials run by the pharma companies. Their targets are different, their motivation is different, and a lot of basic research doesn't translate into clinical trials. This gap is often called the valley of death. With ALS, the problem goes deeper. It is true that at any given moment there are only about 1 in 10,000 ALS patients around the world. However, they die fast and are replaced every 3 years. So the actual chance to get ALS is 1 in 1,000. Therefore, it is not just that the potential market is too small. The more significant problem is the lack of basic understanding of what actually went wrong and why. This leads to very high risk in the process of cure development. At Path for Life, we strive to accelerate the development of a cure, knowing that we would most probably not get to personally benefit from it. I truly feel it is my responsibility to help fight the disease for future patients. Maybe someone here in the audience, or even worse, someone you love. It was always exciting for me to learn new fields, whether as a trekking guide in the Himalayas or as a VP in a large company. However, it is not easy to manage when your voice is barely heard. You can only write with your eyes, and every face-to-face meeting is a logistical operation. Nevertheless, I'm able. Therefore, I must act. Our mission is to minimize the risk for researchers and pharmaceutical companies. We act through 2 main channels: through our unique price model and by creating and maintaining a knowledge and database infrastructure that is free and accessible to all. We use the power of large prizes to focus global attention on the required challenge. The prize model has 3 main values. It enables us to focus and control the results. That way, we make sure we actually invest in the solution itself. Secondly, the competition attracts new minds from various disciplines, in many cases such that had never heard before of ALS, and truly did not think it is within their power to contribute. Last but not least, a competition enables leveraging of resources. Let me give you an example. The most significant obstacle that was pointed out by researchers was the lack of a biomarker that would enable a simple follow-up of the disease progress. Accordingly, our first prize was the biomarker prize. The $1 million prize was granted in 2011. The total investment by all the competing groups was $4 million. Here is another example. We wanted to create an algorithm that will predict the disease progress for a specific patient. Such an algorithm may reduce clinical trial costs by 20%. Over 1,000 groups rose to the challenge, mainly computer engineers and statisticians. 80% of them had never heard before of ALS. Two groups won. One from the University of Stanford, and the other was a commercial company in the business of market surveys analysis. This is what I mean, attracting new minds. The second channel is the infrastructure channel. We invest heavily on infrastructure that serves the entire global ALS research community. We don't know which is the best way to find the cure, but we make it more attractive, cheaper, and less uncertain for more people to try different approaches. For example, we developed a database of past failed clinical trials, the world's largest clinical data on ALS, which we used for the algorithm prediction prize. We are turning data from trials that have failed into a tool to allow future trials to succeed. A tool against one of our major challenges, the challenge of disease rarity. I talked about taking responsibility for the destiny of ALS patients around the world. However, my most important responsibility is the one towards my kids that had to face seeing their daddy fading away through my activities. I want to show them that victory is a way of life. I may be paralyzed, but I can move mountains. Thank you.